So after discussing about the different incisions used for the approach or for the mastoidectomy, then we talked about the cortical mastoidectomy and then the radical mastoidectomy. Now in this, our fourth and final section, we will talk about another procedure known as the modified radical mastoidectomy. And as in the previous two sections, in this section also we will talk about all the indications of modified radical mastoidectomy, anesthesia, position, then what are the steps of operation and post-operative care and complications. So modified radical mastoidectomy, modification of radical mastoidectomy, where as much of the hearing mechanism as possible is preserved. So in this, it's a modified radical mastoidectomy. In this, there is modification of radical mastoidectomy, and in that case, there is no preservation of hearing, and we cannot repair any hearing loss. But in this case, as much hearing as possible is preserved. Disease process which is often localized to the attic and antrum is removed. So in this disease which is localized, limited to the antrum and the attic is removed. That's the incision that is given here. This is the incision, that's the incision, this is the ear canal, and that's the incision used for the modified radical mastoidectomy. Whole area fully exteriorized into meatus by removal of posterior meatal and lateral attic wall. Indications of modified radical mastoidectomy: cholesteatoma confined to the attic and antrum. In this case, we are mainly dealing with the problems limited to the attic and the antrum. So cholesteatomas which are limited to the or confined to the attic and the antrum. Localized chronic otitis media, irreversibly damaged tissues removed, preserving rest to conserve or reconstruct hearing mechanism. The anesthesia and position used for modified radical mastoidectomy. Anesthesia is again mostly general anesthesia is used, and as in radical mastoidectomy, we can use the local anesthesia in some limited cases. But if you remember, I mentioned cortical mastoidectomy, usually the general anesthesia is used. Position is same as for cortical mastoidectomy and then for the radical mastoidectomy. So patient is supine on the back with the face to the one side, and the head ear that needs to be operated is uppermost. Steps of the operation: we have incision, again like radical mastoidectomy. Incision can be post-oral or end-oral incision. Retraction of soft tissue and exposure of mastoid area, same step as radical mastoidectomy. Removal of cortical bone and exposure of antrum and attic. So it's modified radical mastoidectomy, usually dealing with the problems of the attic and antrum. So we remove the cortical bone and expose the attic and antrum. Removal of diseased tissue, cholesteatoma, granulations or unhealthy mucosa is removed. Incus and head of malleus often require removal. So again, removal of diseased tissue, cholesteatoma, granulations or unhealthy mucosa is removed. Incus and head of malleus often require removal. Facial ridge is again lowered. Mastoid cavity smoothed with polishing burr, removing any overhangs and then irrigated with normal saline. So in this, the ridge is smoothed by the burr, and then any overhangs which are present, they are removed, and then the cavity is irrigated with the normal saline solution. Reconstruction of hearing mechanism, and that's the difference. In radical mastoidectomy, we are not dealing with the hearing, but in modified radical mastoidectomy, reconstruction of the hearing mechanism is done. Meatoplasty and closure of wound are same as in radical mastoidectomy. Post-operative care and complications, they are same as radical mastoidectomy. So changes of dressing on day 3rd and 4th. Look for any sign of infection on the dressing. Then we should do the stitches are removed on day 6th to 7th, and then after that the dressing is again applied, and the wound may remain open and it needs to be cleaned, and then suction needs to be performed as until the epithelialization of the wound is present. And then we have all the different complications as the radical mastoidectomy. Facial nerve paralysis is also associated with the modified radical mastoidectomy as with the radical mastoidectomy. So the pretty much the same complications occur in both the conditions. So we have cortical mastoidectomy, we have radical mastoidectomy, we have modified radical mastoidectomy. Cortical mastoidectomy, the mastoid ear cells are removed, all the accessible, and then the aim is to create one cavity. Then in the radical mastoidectomy, we usually deal with the abnormalities of the middle ear and the mastoid bone, and then in the modified radical mastoidectomy, we are mostly dealing with the problems limited to the attic and the antrum. In all the cases other than the cortical mastoidectomy, in which we use the general anesthesia, we can use the general or the local anesthesia in most of the cases. And then the post-operative care, mainly we need to keep the wound clean. Dressing is important. Sutures removed after 6 to 7 days. In this case, radical and modified radical mastoidectomy, we do use the post-oral incision or the end-oral incisions are used. But in this post-oral and end-oral, and the incisions used are in the from 12 o'clock and 6 o'clock position. We can use the vertical, semicircular in one case, curvilinear incision. All these types of incisions are used for the procedures. So that concludes our topic of mastoidectomy, in which we try to cover in detail all the indications of all the 3 procedures: cortical, radical, modified radical mastoidectomy. What are the anesthesia? What's the position, which is in all the cases it's the same. Patient is supine with the head towards one side and the ear which which is operated facing upward. And then we talked about in detail the complications and post-operative care of all these three surgical procedures. And also we talked about the steps of operation which are performed for these cortical mastoidectomy, radical mastoidectomy, and modified radical mastoidectomy. And the main difference between modified and radical mastoidectomy is in one radical we are not dealing with the hearing. In this modified radical mastoidectomy, we try to preserve the hearing as much as possible. So that concludes our topic of mastoidectomy. Thank you for watching sqadia.com.